Hi, my name is Marley Hess, and I'm going to be discussing cystic fibrosis. I'm going to talk about what cystic fibrosis is, as well as what causes it, some of the symptoms, and some of the treatments. And I'll also go over a case study and then an exercise prescription that I came up with for someone with cystic fibrosis. So as defined by the Cystic Fibrosis Foundation, cystic fibrosis is a progressive genetic disease that causes persistent lung infections and limits the ability to breathe over time. So what happens is this thick, sticky mucus builds up in the airways in the lungs, which causes bacterial infections, lung damage, and respiratory failure. So this mucus also affects the pancreas, so this disrupts the release of important enzymes that help us absorb, or help them absorb specific nutrients that are important, such as proteins, carbohydrates, and fats. Usually fats, though, are what are mainly disrupted. Some common symptoms for someone with CF: they will experience persistent coughing accompanied by phlegm, so that mucus that they have in their chest comes up when they cough. They have frequent lung infections such as bronchitis and pneumonia. They have wheezing or shortness of breath. There's poor growth or weight loss because of this inadequate, even though they have an adequate diet, they're not absorbing the nutrients because of that mucus and the disruption with the enzymes released from the pancreas. And also they have greasy or difficult bowel movements, again, because that fat's not being absorbed. They're just getting rid of it through their bowel movement. And these pictures kind of just show examples of some of the health problems associated, and the different, there's a picture that shows the mucus in someone with cystic fibrosis and compared to the airways of someone that doesn't have it. So cystic fibrosis is genetic, so lifestyle factors really can't impact it. It is just caused by the passing down of these defective genes from parents who are carriers. So whenever two CF carriers have a child, there are these chances that 24% chance that the child will have CF, a 50% chance that the child will be a carrier but not show the symptoms of CF, and then a 25% chance that the child will not be a carrier and will not have CF. So if two people that are carriers have children, these are some of the possibilities. And just one thing is, this defective gene contains a mutation, and there are over 1,700 known mutations for the disease. There are definitely many different forms of CF and genetic forms of CF. So there's a few different ways that cystic fibrosis can be diagnosed. So we have newborn screening. So this screen checks for these high levels of immunoreactive trypsin in their blood. And they also sometimes test for a gene mutation called Delta F508. And further testing done includes more blood samples and a sweat test. Genetic testing is also done. This test is able to determine the exact mutation that is causing the CF because there are so many known. The sweat test, like I mentioned earlier, is when sweat is collected from the forearm of a child and the chloride levels are measured. And this is done because children with CF have high levels of chloride because they are lacking the CFTR protein that prevents the salt in the skin from being reabsorbed back into the sweat glands. So that chloride sits on the skin and the doctor is able to check that level. And finally, measuring the nasal lining is one way to check for CF. So what happens is a small electrical current is run across the nasal lining of a person with CF, and someone with CF responds very differently than those without CF when certain solutions are applied to the nasal lining. So this is just another indicator that can diagnose cystic fibrosis in somebody. So there's also a couple treatments that are pretty common with cystic fibrosis. So the first is airway clearance therapy, and what happens is a patient will wear a vest or something called a flutter, which is this vest which shakes, and that helps clear out the airways and bring up mucus, and just kind of helps clear out the chest. There's also mucus thinning medication. So nebulizers and inhalers are the common way that these are taken. Albuterol is one example, which relaxes the airway and makes it easier for the mucus to clear out. Enzymes and nutrients are also important things. The enzymes in particular. So pancreatic enzyme replacement therapy is important because it helps the body absorb those necessary nutrients that the mucus and disrupts. So certain vitamins that are absorbed with fat also need to be taken. So again, that's kind of helping with that, the nutrient deficiency. So that's why some of them are malnourished and underweight. And finally, antibiotics and anti-inflammatories are taken. So bacteria often grows in that mucus that's trapped in the chest, so it must be treated with antibiotics, either orally or by an inhaler, or even intravenously. Anti-inflammatories such as azithromycin and ibuprofen are also helpful. So those are just some of the treatments that someone with CF might have to go through and use. So for this case study, I have Amy here. She's a 24-year-old female. Her cystic fibrosis is categorized as mild to moderate severity, so she's really at the lower end. She's still pretty functional. Her blood pressure is 116/80, so she's healthy that way. Her HDL and LDL levels are fine, so there's no sign of dyslipidemia. Her main concern is her BMI, really. She's a BMI of 17, which classifies her as underweight, which is very common for people with cystic fibrosis because of the nutrient deficiency and the fact that she cannot absorb fats and proteins and all the other nutrients she needs like we can. So some medications that she is on specifically, she's on prednisone, which is an inflammation reducer. She's on theophylline, which is a bronchodilator helping her breathe. And also pancreatic enzyme supplement, which helps break down the fats, proteins, and carbohydrates that she needs for digestion. That's also to help treat her underweight state. So hopefully to help her gain some weight. So there are quite a few exercise benefits as well as special considerations when working with someone with CF. So some of these benefits, and that's important also to share with the client with CF, that exercise capacity can be enhanced. There's improved muscular endurance and strength. It aids in mucus clearance, which is awesome. It helps them breathe better. It aids in skeletal development and bone mineral density, which is important later in life. For improved posture, there's a lot of benefits with that. Increased mobility of the chest wall, which again is important because people with CF do have that difficulty breathing. And also improved self-esteem, which can be really important for someone with CF because they might have lower self-esteem from their condition. Some special considerations when working with someone with CF are that medications do have side effects, such as myopathy and tachycardia being some of the examples of side effects that Amy would have because of her medication. So myopathy, she would have weak muscles, and then tachycardia would be a rapid heart rate. So in her case, when checking the intensity of her exercise, I would not want to use heart rate as an indicator. I would rather use RPE on a scale of 0 to 10 because of her pulmonary condition. And also it's very important to keep in mind that everyone with CF has their own physiological factors that limit their exercise capacity. So in Amy's case, she is mild to moderate. That's the severity of her condition, but some people might be more severe and might be more limited depending on how severe their cystic fibrosis is. And also, with exercise training, there should be a main focus on preventing lung infection deterioration, improving chest mobility and airway clearance techniques, and as well as peripheral muscle function, so strength and power. Those are some of the main focuses that an exercise program should have for someone with CF. So with CF, it's important to test, like before actually writing the prescription, the muscle function, cardiopulmonary function, asking about their habitual physical activity, so how much physical activity they normally get on a daily basis, testing their VO2 peak via a cycle ergometer, and also analyzing the respired gas, just so you know what's going on with their lung function, as well as heart rate, blood pressure, and RPE. And again, heart rate could be impacted by their medications. And during these tests, as well as during exercise, it would be important to monitor pulse oximetry, minute ventilation, tidal volume, and respiratory rate, as well as heart rate and perceived dyspnea. So you always want to make sure, even with testing, those are especially important, but even during the exercise, it's very important to make sure that your client's okay and that they are not being overly worked because they do have that respiratory the problem where they cannot get the same oxygen as we could. So for Amy, what I prescribed was aerobic and resistance training. So for aerobic, and resistance, I went through and I wrote her plan based on the FIT principles. So the frequency for aerobic training would be 4 to 5 times per week. The intensity would be at a self-selected speed, slash intensity. So basically, she doesn't want to push herself too hard. She wants to be comfortable. For time, I would like her to start with any duration tolerated, because depending on how conditioned she is or unconditioned because of the condition she's under, she might not be able to walk very far, or for very long. So I would like her to start with any duration that she can handle. And some different modes that I would like her are types: walking, biking, swimming. So definitely not running, nothing too intense. And I would like eventually, for her goal, I would like her to reach 40 minutes per session. To start, it would just be any duration tolerated, so 5 minutes, 10 minutes, whatever, just work up to that 40 minutes per session eventually. And then for resistance training, I would like 2 to 3 days a week at a 50 to 70% 1RM. So basically I would do a test. I wouldn't do a 1RM test. I would do a very, maybe like a 10RM or something with a lot lighter weight, just to kind of, so we don't push her too much. And then I would like her to do one set of 8 to 12 repetitions or until fatigue. So kind of keeping it at a lighter weight, just one set with higher reps. And then just the type will be weight-based training. So it could either be body weight, it could be light free weights, or just any type of, just more of a lighter based resistance training mode. So then the progression for this would be to eventually increase to 2 sets of each exercise per session. So we're beginning with 1 lighter weight, higher reps, and then eventually getting to 2 sets of each exercise. So 2 sets of 8 to 12 reps per session. These are some great resources I have right here for maybe someone that knows someone with cystic fibrosis, or if someone has it and doesn't understand it. So the Cystic Fibrosis Foundation, this website provides a definition, some symptoms, a diagnosis, what to expect, treatments, and research. That's a great resource right there. And then the American Lung Association is also a great resource. It discusses the ways CF can be diagnosed as well as the treatments there are out there for it. And these are all my references. Thank you so much.